Can we start? All right, hi guys, I'm Dr. Siraj Ahmed, your faculty of pharmacology, and my today's guest is a true symbol of resilience. This is a guy who is going to teach you what is the meaning of do not give up. While many students are going to give up in 1, 2, 3, 4 attempts, someone who stood behind and ran after his dream and he cleared this so-called FMGE July 2025 examination in his 9th attempt. Please welcome Dr. Arjun. Dr. Arjun, many congratulations for this, journey full of ups and downs. How are you
Thank
feeling
you.
right now?
Actually, I didn't sleep for the past 2 days, doctor. It's can't
Out of
I
happiness.
yes, sir, yes, sir.
Okay.
I just read
Okay.
the
Huh.
results and then now only I'm steadily starting feeling that happiness.
Happiness. Now you're feeling happy, and I think the happiness I can see in your eyes compared to earlier when you used to message, and the kind of confidence that I'm getting to see you, it's totally different. And
Yes, sir.
health-wise, also you're looking from past 2 days, even though you have not slept, you're looking a little better. And compared to the mental state you have been in the past, that I can totally understand. Just give us a little bit introduction about yourself, your college, from where you belong.
Okay, okay. As sir, I studied in DMSF, Philippines.
Hmm. Okay.
Graduated on December 2020.
Okay.
Uh, I take coaching from on many other online platforms and offline platforms,
Okay.
but
Okay.
it doesn't help me to crack 150 plus.
Okay. Okay.
And then I start believing like self preparation and concise notes and giving multiple questions for the practice.
So, can you describe any reason that was holding you? Was it, do you think the notes was not enough? Yeah, question ka language mein there was something, you are facing some problem. What exactly do you think was the problem?
Actually, my difficulty is the comprehension of the question that was asked in the main exam.
Hmm.
And many, I feel the personal feel is, doc, if we practice more questions, the
Hmm.
content will get in the exam. But
Okay.
the option is so twisted in the real exam. So I
Hmm.
just marked the correct answer, but whenever I get the results, it was like 130 plus and 140.
Hmm.
So I don't know because the we don't get the answer key itself right. So what to say? We just I leave it that side.
What I understand from what you're saying, ki you are having difficulty in, actually understanding the question, what actually they're trying to ask, or you are
Yes,
missing the main aspect in the question.
diagnosis I know.
The clinical things. Okay.
Options they are like two lines and then more than one line,
Hmm.
and the way of grammar they used in the main exam is
Hmm.
too deep for me to understand in the single minute. I just practiced more
Understand.
questions just to finish the question and then make possible
Yeah,
because
I can understand, and I'm feeling really happy that you actually said the truth, because not many students will accept the fact that I made this question wrong because I could not understand.
yes,
मतलब
sir,
जो
yes.
language of the question, the English of the question, sometime it is so difficult to understand that many students made mistake because of the language. It has been
Yes, sir.
given in such a way. I think that was your issue, language issue.
They get the correct answer. I studied, I marked the correct answer,
Hmm.
but the game is between the twisted options in the real exam.
Exactly, exactly.
So,
So, do you
that,
think there were lack of enough practice?
uh, actually, sir, reading the notes is too much pressure for us because I
Okay.
continuously studying
Uh,
again and again the same subject and the topics. But
okay.
whenever is I didn't get like if I practice 20 questions, I will get only 12, 11. I didn't get 15 like that.
I got.
So
Hmm.
so whenever I feel I mark the wrong option, I didn't lost the hope.
That
It's
is
okay.
something, that is something very motivating. Tell me, what kept you motivated throughout this journey? I mean, you passed MBBS somewhere in around 2020, if I'm not wrong, because you are passing here in
Yes.
2025. The 4 attempts you have given already. So what kept you motivated throughout this journey? Because at the same time, when you came to India, someone also went to your college and they also came by now, or maybe they are coming in the coming year, right? In the coming month. So
Yes.
what kept you motivated throughout this journey of yours?
Sir, actually, I studied more than enough in the college days itself.
Okay.
My grade is also good there. And
Mm-hmm.
whenever I come there, the pattern and the way of asking the question in FMGE is
Mm-hmm.
too difficult for me, because
Okay.
when I see equal paper and NEET PG paper,
Mm-hmm.
it's so manageable. When I practice in my home, it's manageable.
Mm-hmm.
But whenever I am appearing for the exam, it's my little story for the juniors is
Mm-hmm.
what they can studied in the MBBS course.
Okay. Okay.
Just be sure in your concepts.
Okay. Whatever they are reading during their MBBS, they have to be through with their concept. That's what you're saying.
And
Okay.
then
Mm.
don't discuss with too many members, like a group discussion, and then clearing the concepts in between the two. Because if he reads something, the other people will tell something that he understands in another way.
Okay.
It is damaging our practicing
Concept.
question.
Yeah. Yeah.
Real example, the same exact other option will be there.
Okay.
So the one people will get correct answer and another people will get a wrong answer.
Right. I totally understand. I think what you're saying, trying to say too many cook spoils the
Yes.
broth. So for one
Yes.
concept, just follow the way that you have already understood, follow your teacher or follow if you have understood by yourself or maybe from many videos. And you also mentioned about that they
I
have
want
to
to.
be reading from their MBBS college, MBBS time. Did you read during your MBBS? Let's say
Sir,
pharma. How did you read your pharma during the MBBS?
like 2016, I started pharma and anatomy in my first year. I just passed, and then now whenever I started my preparation for FMGE, it's too difficult for me to understand the concept. And whenever I practice pharma,
Hmm.
I was very blank. I will get only 3 out of 10, 4 out of 10 only.
Okay. So how did you handle that?
I handle like I searched too many lectures and started. I whenever I come here, I joined one platform that
Mm-hmm.
is that me, and another platform that all doesn't help me. So I
Mm-hmm.
planned search for the pharma faculties, and then I started preparing your notes from the previously you have given.
Okay. Different platform. Yeah. Okay.
I just written your notes from your my handwritten and watched
Okay.
your videos. I
Okay.
have of yourself. Still, I'm
Very nice. Very nice.
whenever I get the last attempt to 141,
Hmm.
the few Medded was given the free subscription for the those who scored above 140.
That sub scholarship by MEDED. Yeah. Okay.
Sankalp batch.
Sankal batch. I understand. Okay.
Because I won't be don't depressed because of the mark doc, because I will
Hmm.
get 140 plus 140 plus. Why
Hmm.
we should get too depressed and then
Wow.
uninstall all? Because I just randomly search what are all the possible we can get for the free subscription and what are all the
Hmm.
for the preparation purpose.
Okay.
Because I have your notes, but your videos won't be available because now your videos are available only in the midday.
Okay.
So I got enrolled in the Sankal batch. That why I texted you also,
Yes. Yes.
and then
Yes.
all your rapid division notes to a
Okay.
video,
Okay.
and then check my notes, and again I practiced solving
Device.
questions. Also.
Very nice. Very nice. So, do you think those video lectures, the revision video lectures helped you during actual examination?
Because we have to understand the notes, we have to keep the notes aside and
Uh-huh.
then watch videos.
Uh-huh.
I like 2 times the rapid division alone from yours.
Okay. Okay. So, were you able to solve question? Do you think those were clinically oriented lectures that was taught during Sankal batch? Were you able to solve the actual exam questions?
Yes, sir, because I watched every subject has 50-50 questions, right?
Mm-hmm.
I just note the other options, what is the possible thing for that option.
Hmm.
I write the option, and then I just what are the possible for the other options. I just
Very,
mark it itself, and then the PDF, and you are given the Sankalp batch and Telegram also. You will come at live for that 30 minutes live.
Yes, 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 yes. I remember. We used to come in the night for the telegram. Right. Yes.
The thing is, there are so much frustrations I had. I'm
Hmm.
not even talking to my friends. I'm not even talking to anybody. Even family also. I
Hmm.
was depressed a lot. I
Hmm.
just believe what are all the contents we have.
Hmm.
We will, and then we will motivate like each other.
So, how did you handle the kind of disappointment that you're mentioning? That you're not talking to friends, not talking to family. How did you actually handle? Matlab, why I'm asking this, that you are on the other side now. You can guide many other students, those who are at your position. So, if you have made it, I think other student, if they follow your footstep, they can also get through this one. So, what made you, that I can do it kind of attitude? How did you handle the disappointment, the societal pressure? How did you handle that?
But actually, I didn't lose the hope because my
Hmm.
mark is less than 100 or 80, something like that. Because
Okay.
all the can get 120 plus, sure, if they are somewhat knowledge about medicine, like all the 19 subjects.
Okay.
The factor is if we have good concepts and question solving practice,
Hmm.
easily can get above 40 marks and 50 marks.
Hmm.
Crossing the 150 is too much heavy for others because easily they can get 120.
120 they
Even
can get. You're totally absolutely correct.
120 we can get whatever it is possible, but
Hmm.
crossing that 130, 140, 150, 30 marks and then 40 marks. Now I still can't believe, I'm just not pricing myself. I
Hmm.
got 157
Hmm.
purely by the additional marks what I am practicing through the other platforms, and again and again the ruling out the option is the main key.
The art of solving the MCQ that you learned while solving the MCQ, that whatever thing that you don't know the answer, even you learned how to rule out the option, right?
Yes, yes.
Okay. So let us say in the beginning you got a score of 130s, 120s, then later on you came into 140s. So when you shifted your study pattern, that is how you got 140s, and then suddenly you no at the end you got 167. So what different did you do this time? What were the mistakes that you are doing that you think was a mistake, and now I did something different that made me clear this exam?
Sir, actually, there are so many important topics for NEET PG and in FMG, sir. There are
Okay.
separate topics in every exam,
Okay.
and then repeated topics. I handled it like reading all the concepts like clear.
Hmm.
Coming to evening, I just read the notes what I have mainly focusing on, and
Okay.
after him, I started questions like 50 questions custom module.
Okay.
I will solve and then review for another 30 minutes.
Okay.
And the night also, again after 8 p.m., I will solve 50 questions and
Hmm.
review. So reviewing the same questions
Revision
and
is your art, and solving MCQ is something that you did different this time.
yes, sir, yes. And then whenever I solve the next day, the same question will come.
Hmm. Okay.
Wrong in that previous day, the another day I won't sure get that wrong. I will mark the correct one.
Okay. So you were sitting at home and doing all these thing all by yourself.
Yes, sir. Yes, sir.
Was all self-study, and you got some help from the embedded app in the end that you were mentioning, that Sankalp batch
Yes, sir.
access
Yes.
that you got, and through that did you give their GT, that predictor
Yes,
GT? How was it?
previously I have 8 attempts, sir. So I did like GT, like one attempt I gave like 10 GTs, 11 GTs. I just only focusing on GTs and gave attempts for one time at all.
Hmm.
But now I realized like before 1 month, doctor, before 1 month, we can give GT. But many students are facing like if they get 130 plus, 140 plus, they are becoming depressed and
Hmm.
not studying the another day. So if we practice like 50 questions, 50
Hmm.
questions
Hmm.
only, we can get see the difference between how we are preparing. So this time I didn't give GT at all, sir.
Okay.
This
Even
time
even in the last month also you did not give GT?
I didn't give any G.
Okay.
And then I practiced only 50 questions alone
Okay.
daily.
Practiced 50 question, but you did not give a full length GT.
Full length GT I didn't give that.
Okay. Okay. Usually
Because
he is always advised someone like in the first attempt, second attempt, third attempt. Reason being that they should know how to balance the time, how to actually
yes,
tackle
sir.
the MCQs, right?
Because the previous attempts I was learning so many lessons, doc. Because in a real exam, the question also will be so much cruel and timing management. I just marked 4 5 questions without reading the question because the time is going to end.
Yes.
Now I realized like even though what are all the time it is, the main exam, the clock will be on the other side. We
Hmm.
have to mark what are all in the mind. So
Okay.
we want to practice more questions, doc, and then little concepts strongly.
Okay.
I was not suggesting like to study
I
all
am.
the book, how to study
Hmm.
all the book, and then because every time the pattern is changing, doc.
Hmm.
From they are integrating with other subjects and surgery 40 questions, OB-GYN 40 questions. And
Hmm.
mainly last attempt also in diabetes, they have asked so many questions on pharma. I
Right.
managed well, but when I saw the recall, it's absolutely somewhat different. And I didn't get like I got only 141 and like
Hmm.
so every mark is so important for FMG aspirants.
Right. Right.
Yeah, and
Right.
one more thing, doc. Whenever we are comparing the NEET PG questions and FMG questions,
Okay.
they are like the standard is all same,
All same.
all same.
The language
I
of question, everything is same almost. Yeah,
there
that
are
we all teacher also talk about it, that the pattern and the level of the FMG question is quite similar to FMG question as well. Yeah. Arjun, tell me something. While the journey, I think I have asked a similar kind of question before, but I'm asking again. Uh, did it ever happen to you that you felt like, I want to get rid of it? I cannot take it anymore. Were you, you know, able to recall any such incident that has happened with you? Complete
uh,
burnout. I can't take it anymore. That's it.
I I got that feel whenever before seeing the results before.
Hmm.
But my aim is, doc. All students can get 150 plus if they sit for 3 months without going anywhere and consistently reading the concepts and giving the
Like,
MCQs. I
that
did.
is what you're saying now. But when you had that kind of moment that I cannot take it anymore, that's it. I'm done with this examination. What did you do to overcome that?
Actually, I don't know how to express that, soccer, because I was thinking about my life a lot and I can't do anything other than that because I spent almost 5 years in the other country and
Yeah,
came here and giving so many attempts.
yeah, yeah. Okay.
Profession is so precious, dog. Like, if we want to jump another profession and do something, my
Hmm.
heart won't give that much space. And
Mhm. So I think what kept you going, that I can understand from what you're saying, that it is my journey. I cannot pause. I cannot stop. I have to take it forward. That is what you're trying to express. I can totally understand. But anyways, the decision that you have taken is was totally, it's worth it. And now you will be able to enjoy every bit. Even
yes,
if you're going with the, for a movie with your friends, you will be able to, enjoy every song, every actress that is coming on the screen, everything that is happening. Can you recall of any mistake that you did during your preparation that you don't want your juniors to make the mistake? Do you think
the
of
mistake,
any mistake?
uh, there are, to be frankly, doc, there are too many platforms now.
Huh.
And then the thing is, if what are all the it all depends on the personal opinion. If
Okay.
me, you are the best doctor in pharmacology for me.
Okay. Okay. Okay.
Almost all the lectures in different platforms I practiced, studied also, and practiced MCQs also.
Uh-huh.
So they have to choose all the individual lecturers
Okay.
depending on their personal opinion.
Right.
We have to don't I won't recommend like do from him. It's
Yeah.
all there. So that's the thing, doc. If
Very
you
nice.
want to
Very nice.
consistent with that one professor and
Mhm.
his no
Select
and
your
practice.
faculty, select your faculty and keep moving. Like you
Yes,
selected, let's say for pharma, you selected my notes and you feel that, okay, that is the best. And that helped you also, as you said, during your previous question answer. So after many number of times you have seen the result and every time you used to say fail, fail, 140, 120. Suddenly on 13th evening, there is a result that came and in that you saw that this is the result and it says pass. Were you able to believe it in the first go or you checked your roll number again and again? Mera hi hai.
I just blinked and then rechecked my number.
He checked,
I
hai na?
said, Mom, I sent it to my mom and my
Okay.
roll number also. Ma'am, kindly check. I just saw one number, but
Uh,
I want number. Kindly you also check and tell me. I
uh,
sent it to my friends who are close. I have two, three close friends. I
uh,
just sent also my roll number also. Please again recheck. And then it was like I was alone in the home doc. If I was somewhere, it will be so. And then my friends came.
mm.
They celebrated with a cake. That was a memorable moment in my life.
Right,
So,
right. I think I can recall usually I used to say short poems, short shairis during the class. I just remember looking at your condition right now. एक short शायरी, if you can understand Hindi or maybe for my other students, that रात चाहे कितनी भी लंबी हो सुबह जरूर आती है. I'll give the English, English version also. रात चाहे कितनी भी लंबी हो सुबह जरूर आती है. एफएमजी की मेहनत में जो डटे रहे सफलता उनकी डेफिनेटली साथी है ना. What I said, that no matter how long is the night, it is going to be a morning. Definitely, sooner or later, it's going to be morning. And in the examination, like FMG, someone who is being persistent, like Dr. Arjun, they are going to get successful by hook, by crook, by anyhow. That's what I said, right? So I think you have been a true example of resilience, and I will not leave. I will not leave. जब तक तोड़ेगा नहीं, तब तक छोड़ेगा नहीं. And that is a dialogue from another movie, that I will not leave until I am done with this.
yes, sir.
So, I'm sure, Dr. Arjun, your story is going to inspire thousands of FMG students, especially for those who are feeling stuck behind even after multiple attempts. And your journey is a proof that if someone wants to get it done, mind makeup agar ho gaya hai, then definitely they will get through this examination. It is also, I would say that your journey, we cannot say it's a opposite of success. It's a part of the success, the way that you have taken forward. And this examination is not only giving you, a way of handling the subject, but it also given you a way of approaching the life, that
Yes,
sometimes life give you lot of, back end, lot of pushback, but once stand firm, you are going to get through this anyhow. And
yes,
since this was, I would say, the lowest mode of your career, and this
yes,
was the, I can say, the सबसे नीचे basement, this was the lowest mode. After this, there is no going back, there is no stooping down further. This was the lowest mode. Henceforth, you will be moving upward, and sky will be your limit. That is what I can say, Dr. Arjun.
thank you.
Any last messages for our students, for the juniors? Relating to many students are running for one liners, especially, and running for some of them are running for clinicals. How can you give them your final message?
So I'm not so much mature to give advice, just my experience. I'm just sharing.
Experience matters a lot.
We can't predict what are all the questions coming in that upcoming like 17th Jan FMG doc.
Mhm.
Maybe it could be like half of them are onliners, half of them are clinicals.
बिल्कुल.
So stay consistent with your process,
Okay.
practice questions,
Okay.
and revise again the same repeated topics that was asked before.
Mm-hmm.
Although you are tired of reading the past year questions,
Mm.
just topics is important.
Okay.
Don't practice only the questions and I think like I have done this topic.
Mm.
Read a topic and have your own notes.
Okay.
written notes, and truly all will can success this FMG doc.
Hopefully. I wish you very best for the upcoming future,
Thank you.
challenges that is coming along your way, and I'm pretty sure you'll be able to get through this with
Thank
a
you.
honest and innocent smile that you're holding right now.
Yes,
Many congratulations to you and also to your parents. I will see
thank
you around. Thank you very much, Dr. Arjun, for joining.
you. Come and meet you, sir. Surely.
Definitely, I would love to meet you in person. Right? Would love to. Right? Chalo, see you. Bye bye. Bye bye. Stay in touch.
Thank you, sir.